Welcome to Houston Baptist. These presentations are only intended to highlight some important or difficult points from the chapter. They are in no way comprehensive and do not include all of the material that students will be held responsible for on exams. You are expected to completely and thoroughly engage with all of the required learning materials. Exams in this course may include questions taken from the textbook reading, videos, PowerPoint presentations, or links. This presentation covers some important topics from Chapter 2 in our textbook, Core and Doka's Death and Dying, Life and Living, 8th edition. Make sure you read all of the chapters and take notes. There is much more material in the chapter than we are covering in this presentation. In the USA, death rates have declined. Factors impacting death rates include gender, race, and social class. In Chapter 5, we discuss the racial and cultural differences, so for right now, we'll just consider gender and social class. Male death rates are somewhat higher. Can you think of possible reasons why? Here's a report from the Australian Bureau of Statistics. Is it genetics, work role differences, lifestyle differences? In addition to gender, the least advantaged socioeconomic classes tend to have higher death rates, possibly due to economic advantages. The average life expectancy in the U.S. has also lengthened. From the early 20th century up to now, the ALE, average life expectancy, increased from less than 50 to 78.8 years of age. This chart shows what that change has looked like. What this means is that more individuals are surviving birth, infancy, and childhood, and medicine has prolonged the lives of many which illnesses might have previously taken those lives. Death is now mostly associated with the aged. In 2014, 73% of all deaths. If you check out Table 2.3 on page 27 in your text, you can see the changing causes of death in 1900 compared with 2014. Our top three in 2014 were heart disease, cancer, and chronic lower respiratory diseases. These will change according to age breakdowns, with young people dying more frequently in accidents and older people more commonly dying of cancer or heart disease. Communicable diseases are acute diseases that can be transmitted or spread from person to person. Today, in developed countries, relatively few people die of communicable diseases, except for the following: influenza, pneumonia, infection with HIV and AIDS. Current concerns include diseases such as West Nile, bird flu, meningitis, Ebola. In North America today, the largest numbers of death result from degenerative diseases. The top four leading causes of death in the U.S. are 1. Heart disease, 2. Cancers, 3. Chronic lower respiratory diseases, which is formerly called COPD, and 4. Cerebrovascular diseases, with the top two accounting for more than half of all the deaths in recent years. Make sure you read the rest of the chapter carefully and understand the rest of the terms and concepts referred to in the chapter, including, but not limited to, dying trajectories, encounters with death, living-dying intervals, and the 6 principal factors correlated with changes in death-related encounters.